When did you last notice something odd about your body and decide it was nothing? Maybe a headache that felt wrong somehow, or finding yourself stuck on a word you've used 1,000 times, or tripping when there was nothing to trip over. But what if I told you that right now, hundreds of thousands of people are walking around with something growing in their brain, and most of them have no idea? What if that weird headache, that lost word, that stumble, was actually your body trying to get your attention? The National Brain Tumor Society estimates that approximately 90,000 people will be diagnosed with brain tumors this year. These tumors don't pick and choose, they can develop in anyone, no matter their age, gender, or how they live. They're slightly more common in males. Brain tumors are abnormal cell growths that develop in the brain or surrounding areas. Some begin in the brain, primary, while others spread there from cancer in other parts of the body, metastatic. Doctors classify them as either benign, non-cancerous, or malignant, cancerous. But both types can be serious. They may press on healthy brain tissue, cause damage, or block the fluid that flows around the brain, triggering various symptoms. There are over 120 types of brain tumors, each affecting different tissues in the brain. It's important to know that not all brain tumors are cancerous, but non-cancerous, benign tumors can still be life-threatening depending on their size and location. Today, let's examine together 8 brain tumor symptoms, what they look like, what matters, and when you should reach out to a healthcare provider right away. Be sure to stay until the end, as the 8th symptom is often mistaken for other conditions. Do you know anyone who has or has had brain tumor? What part of the world are you from? After you've watched the video, drop a comment below so we can get to know each other better. Symptom 1. The morning headache. Everyone gets headaches, which makes this sign hard to spot. But there's a specific pattern here that's worth knowing. If headaches are consistently worse in the morning, or when lying flat, that's unusual. Normal headaches don't care much about position or time of day. The reason this happens is mechanical. Fluid in the brain accumulates when someone is lying down. If there's a mass taking up space, the pressure has nowhere to go. So mornings hurt. Regular pain medication doesn't help much. And sometimes there's vomiting that comes out of nowhere without the usual warning of nausea. What makes this worth paying attention to is the persistence. One bad morning means nothing. But if every morning starts with a headache that gets better as the day goes on, and this pattern repeats, something is creating pressure that builds overnight. That's not normal. Symptom 2. Seizures. Seizures can stem from various medical conditions. When a brain tumor is involved, seizures may happen because the tumor is causing irritation to that specific brain region. The way seizures manifest can also differ significantly from person to person. Seizures aren't always dramatic episodes where someone becomes unconscious and experiences full body convulsions. They can be far more subtle. A seizure might affect just one particular area of the body, leading to symptoms like tingling sensations in an arm or leg, mental confusion, or difficulty with speech. What matters most here is timing. Seizures that start in childhood usually have genetic explanations. But when seizures start in adulthood, especially after age 40, they suggest something structural has changed. Something is causing electrical activity in the brain to go haywire when it never did before. This is one of those signs that demands immediate investigation. Symptom 3. Language problems. Language lives in specific parts of the brain. When something interferes with those areas, speech gets weird in predictable ways. Some people find themselves struggling to get words out, like pushing against resistance. They know exactly what they want to say, but producing the actual sounds becomes effortful. Others have the opposite problem. Words flow easily, but make no sense. They construct perfect sentences that mean nothing. The key is that this represents a change. Someone who is articulate starts stumbling over words. Someone who never had trouble with vocabulary suddenly can't access terms they use regularly. And it gets worse rather than better. If this were just stress or fatigue, it would fluctuate. When it follows a downward trajectory, that's a signal. Symptom 4. Vision getting strange. When a tumor compresses specific brain regions, particularly the occipital lobe or optic nerve, it can interfere with vision. Potential visual symptoms from brain tumors include blurry or double vision, unusual eye movements, increased light sensitivity, and vision loss ranging from partial to complete. Any changes in vision should be evaluated by a neuro-ophthalmologist or your primary care physician. Symptom 5. personality and behaviors changes. This one is hard to recognize from the inside. It's usually family members or close friends who notice first. The person they know starts acting differently. Brain tumors can produce symptoms that resemble mental health disorders, appearing as changes in personality, behavior, mood, and thinking. These neuropsychiatric symptoms can cause significant distress for patients and families if left untreated. Personality changes are particularly challenging for caregivers. A once motivated person may become passive, or someone previously kind might turn irritable and controlling. Families often grieve the loss of who their loved one used to be. Other symptoms include aggression, delusions, hallucinations, impulsivity, mania, paranoia, and violent behavior. In severe cases, these changes can endanger the patient, caregivers, or others. These symptoms can result from various factors: tumor location, brain damage from the tumor, the patient's age and health, emotional impacts of the diagnosis, medication side effects, and other medical conditions. Symptom 6. Cognitive difficulties. Brain tumor patients frequently experience cognitive difficulties. These changes can be so minor that patients are the only ones who notice, or they may be obvious enough that caregivers spot them first. Common cognitive issues include memory and learning problems, difficulty remembering new information, especially in the short term, communication challenges, struggles with finding the right words or expressing thoughts through speaking, reading, or writing, focus issues, being easily distracted and having trouble handling multiple tasks, thinking and planning difficulties, problems of logic, decision-making, organizing, and understanding how actions lead to consequences. How these symptoms present depends largely on where the tumor is located, how big it is, and how quickly it's growing. Report any cognitive changes to your healthcare team. They may recommend a thorough neuropsychological assessment. Symptom 7. Dizziness. The cerebellum, tucked under the back of the brain, coordinates movement and balance. When something interferes with it, people experience a specific kind of unsteadiness. Walking becomes uncertain, with a tendency to drift or veer. Fine motor tasks get clumsy. Some people described feeling drunk when they're completely sober. Judging distances becomes difficult. Even sitting requires more attention than it should. Unlike temporary dizziness from ear infections or dehydration, this kind of imbalance persists. It's there when someone first wakes up and it's there at night. It affects more activities over time rather than resolving. Research published in the journal Neuro-Oncology Practice indicates that over 70% of individuals diagnosed with malignant glioma experience movement-related difficulties at some point while living with the disease. Symptom 8. Nausea and vomiting. As a brain tumor enlarges, it occupies more room inside the skull, raising intracranial pressure. This pressure buildup can trigger nausea. Tumors may also disrupt hormone production, leading to similar feelings. Nausea and vomiting can result from tumors in specific brain regions. For example, if a tumor presses on the cerebellum, the area controlling balance, it can cause dizziness and nausea. Similarly, pressure on the brainstem may produce double vision, which can also make someone feel nauseated. How are brain tumors diagnosed? Diagnosing a brain tumor often involves multiple specialists and can be complex. However, brain tumors are sometimes detected incidentally during imaging tests ordered for unrelated conditions. If you show signs of a brain tumor, your doctor will conduct a physical examination and gather information about your symptoms, medical history, current medications, previous treatments and surgeries, and family health background. Your doctor may also perform a neurological examination to check for changes in balance, coordination, mental functioning, hearing, vision, and reflexes. These findings can help identify which brain region might be affected by a tumor. When a brain tumor is suspected, the typical next step is brain imaging, usually an MRI scan. None of these signs mean someone definitely has a brain tumor. But combinations of these signs, or any of them persisting and worsening over time, warrant investigation. Pay close attention to any unusual shifts in your physical or mental state, particularly if they appear suddenly or progressively worsen. While these symptoms could indicate various health issues, it's essential to discuss them with your doctor. Seek medical attention if you experience worsening or persistent headaches, new or atypical seizures, vision, speech, balance or personality changes, significant confusion, excessive drowsiness, or memory problems. Symptoms that persist or recur despite treatment. If this video helped you out, give it a quick like and share it around. It could really help someone else looking after their brain health. Want to stay in the loop with more help tips? Just hit that subscribe button and turn on notifications. We release new videos every week. Your likes and comments really keep us going. They show us what you want to see more of. And before you go, check out these 2 videos we selected specially for you. I think you'll love them. Thank you for watching, and remember to take care of your brain health. Bye.